COVID-19 affects all aspects of daily life, including travel, trade, tourism, and financial markets. To reduce the impact of COVID-19 on businesses, workers, customers, and the public, it is important for all employers to plan now for COVID-19. It is a requirement of the Occupational Health and Safety Act that the employer must provide employees with a healthy, safe, and hazard-free working environment. COVID-19 is a respiratory disease caused by the SARS-CoV-2 virus. It has spread from China to many other countries around the world. It originated in Wuhan, China, and different strains of coronavirus have been found in a range of animals, ranging from camels to bats. COVID-19 is spread via human-to-human contact and from infected surfaces, but the new coronavirus can be spread through respiratory droplets. These droplets are liquids that can be emitted when we cough or sneeze. They are heavier than air and travel about a meter, then rest on whatever surface they land on. This is why it is very important to avoid close contact with anyone who has fever, cough, or any other respiratory symptoms. The World Health Organization currently states that the incubation period is up to 14 days, but sometimes it could be longer, even up to 24 days, but typically symptoms show in about 5 days. 80% of patients develop mild disease, about 15% severe, and 5% become critically ill. Symptoms of the coronavirus include having a fever, fatigue, body aches, cough, definitely having shortness of breath, perhaps a history of travel, and if you have come into contact with anybody who might have been exposed. Older adults and people of any age who have serious underlying medical conditions might be at higher risk for severe illness from COVID-19. People with underlying blood disorders, weakened immune systems, including undergoing cancer treatment such as chemotherapy or radiation. People with HIV or AIDS, or has an organ bone or marrow transplant. People with lung diseases such as asthma or suffering from TB. The main thing is to adopt good hand hygiene. Wash your hands frequently with soap and water, or use alcohol or hand disinfectant gel. Catch coughs and sneezes with disposable tissues and dispose of them correctly as soon as they are used. If you don't have a tissue, use the inside of your elbow. After sneezing or coughing, wash your hands again. Avoid touching your eyes, nose and mouth with unwashed hands, and finally, avoid close contact with people who are unwell.
Wet your hands with water. Apply soap, rub your hands palm to palm, and wash the backs of both hands and in between your fingers. Then palm to palm with fingers interlocked. Clasp your hands together and rub. And then clean around the thumbs too. Rub your fingertips in the palms of your hands and finish off with the wrists. Rinse your hands really well with water and dry them thoroughly with a paper towel. Use the towel to turn off the tap. Your hands are now clean.
Remember to remove any jewelry such as rings and watches before washing your hands, as these are often forgotten about but can easily harbor infection. The virus can survive on surfaces such as metal, glass, and plastic for a number of days. When wiping down surfaces, use an S-shaped motion which will allow you to cover the entire surface area. make sure that you pay extra attention to the sides, corners and edges of surfaces. Surfaces that should be wiped and cleaned regularly include those in the healthcare sector, all toilets and sinks. And don't forget about public areas such as public transport. Also remember that cleaning your phone screen with alcoholic wipes twice a day can help to drastically reduce the transmission of COVID-19. Companies should practice social distancing. This means that travel should be avoided, also avoiding places where large groups of people gather, and limiting any gatherings that include high-risk individuals. Avoid contact of less than 2 meters between you and persons or someone you suspect of having the infection. Contact includes hugging, kissing, or shaking hands. And always avoid touching your face even when you are using a mask.
Before putting it on, clean your hands. Pinch the wire at the top on the bridge of your nose, hook the elastics around your ears, and make sure that your nose and mouth are well covered with no gaps. Try not to touch the mask. If you do, wash your hands straight away. When taking off your mask, remove it from behind, don't touch the front of it, and throw it away into a closed bin. Don't forget to wash your hands well straight after.
When removing gloves, you don't want to touch any bodily fluids on the glove, so there's a special way to take gloves off, which is much more careful than when putting them on. First of all, pinch one glove on the outside and remove it, turning the glove inside out in the process. What this does is keep any contaminants on the inside. Another good thing about doing this is that if there's any used dressings, tissues, or anything that may harbor contamination, you can scrunch it up in your hand before taking the first glove off, and then contain it in the inside out glove. Once you have taken the first glove off, keep hold of it in your other hand and scrunch it up into a ball of your gloved hand. Then put a non-gloved finger underneath the second glove without touching the outside and pull the glove fully off, again turning it inside out with the contaminated things on the inside. Finally, you want to dispose of this correctly, which can be in anything such as a biohazard bin, a sanitary bin, or securely double bagged in your rubbish. If you are infected, stay home and separate yourself from other people. This means even not being in the same room as them. Only allow people who live with you to stay, and stay in a well-ventilated room with a window that can be opened. If separate bathroom facilities are not available, think about a bathroom rotation, where the isolated person uses the bathroom last before thoroughly cleaning the bathroom themselves. Use separate towels from anyone else in the household. Also wash crockery and utensils thoroughly with soap and water. Do not go to public areas, schools or work, and do not use public transport like taxis, buses and trains. Also do not share dishes, drinking glasses, cups, eating utensils, towels, bedding or any other item in the home. It's normal to feel sad, stressed, confused, scared or angry during a crisis. Talking to people you trust can help, so contact your friends and family if you feel this necessary. If you feel overwhelmed, talk to a health worker or counselor. Have a plan, where to go to and how to seek help for physical and mental health needs if required. Your company can assist you with this. It is important to maintain a healthy lifestyle, including proper diet, sleep, exercise, and social contacts with loved ones by email and phone with other family and friends.